I am Dr. August and I'm going to be conducting a cranial nerve exam today. Okay, so just looking at your notes, I can see that you've been suffering with a little bit of tingling on the face. Okay.
Yeah, right here on my left side.
Okay, is it painful at all?
No, not painful.
Okay, and how long has that been going on for?
I noticed it first time when I started applying makeup with a sponge. If I dab my face, then I'll feel a little tingling sensation.
And does it stop as soon as you finish touching your face?
Usually it stops right away, yes.
Okay. Right. Just a couple of questions for you. Are you currently on any medication?
Yes, I'm on allergy medication, just over the counter.
Okay. And any recent surgeries on the face or upper body?
No surgeries, no.
Okay. Any recent injuries to the head at all?
No injuries to the head, absolutely not.
Okay. And recreational drugs and alcohol?
No recreational drugs. I do consume alcohol about once a week.
Okay. Caffeine intake?
Yes, I do drink coffee every day.
Okay. How many glasses a day or cups?
About 5 cups a day.
Okay. And any other kind of major illnesses in the family, such as multiple sclerosis, Bell's palsy, anything like that?
My dad passed away from pancreatic cancer.
Okay.
Other than that, no other major history, no.
I'm very sorry to hear that.
Thank you.
Alright, well, that all sounds very straightforward, okay. What I'm going to do is conduct the full 12 cranial nerve exam. I am going to focus slightly more on the facial nerve and the trigeminal nerve, which are responsible for sensation here and here. And I'm probably going to do a little bit more of a lengthy exam, especially on the head and the hairline, if that's okay.
Sounds great, thank you.
Alright, so, okay. So, we are first going to start off with the oculomotor and the optic nerve. So I'm just going to pop some gloves on. Alright, so just going to have a quick look at the eyes to begin with. So there's no obvious swelling, good symmetrical shape, no redness, no cuts, lesions. You could just keep looking straight ahead. Okay. Alright, so I'm just going to ask you to face straight ahead, and we're going to look at the optic nerve, which is responsible for vision. Alright, so just want to check that there's no blind spots anywhere. So you can see this, there's no issues with your vision.
Yes.
All good?
Oh, good, yes.
Alright, so I'm going to ask you to just hold this over your eyes. Okay. Right, I'm going to ask you to just read out this bottom line.
PFCDTZP.
Okay, and if you could just swap to the other eye. Perfect. Alright, and this line, please.
DPCZLFT.
Perfect. Is the green or the red line more prominent for you there?
They look the same to me.
Okay, if you could just swap the eye. Again, is the green or the red more prominent?
The same.
Okay, that's great. Just take that for you. Okay, so just following my finger. Any double vision?
No.
Okay. Just tell me how many fingers.
2, 1, 3, 5, 1.
Okay.
1, 2, 3, 2, 3, 4.
Perfect. Just relax there for me. Alright, so as part of the oculomotor abducens and trochlear nerve, they look at eye movement. Okay, so I'm going to do a variety of tests that focus on your eye movement, pupil response and traction. Okay, so just looking straight ahead for me. First of all, I'm going to check your pupil response. Okay, really good pupil response there. Alright, so I'm just going to have a physical feel, okay? Okay, I'm just going to press on your eyes ever so slightly. Just tell me if there's any pain.
No pain, no. No pain.
Okay, and just relax. If you could just open your eyes. Okay, I'm just going to get you to any pain as I'm stretching those eye muscles.
No, no pain.
On this side.
No pain, no.
And
No.
and any pain there?
No. Oh, good.
Okay, just blink a few times for me. I'm now going to have a closer look. Okay, so just looking straight ahead. And if you could look down and then up. Look down and then up. Right. The blood vessels, the capillaries in your eye are slightly inflamed, okay, so they've risen to the surface quite a bit. Is this something that you have noticed before?
I wear contacts even right now, so usually yes, my eyes get dry.
Are those monthlies or dailies?
Monthlies.
Okay. So I might suggest speaking to your optician about switching to dailies. Much better for the hygiene of the eye, okay? It may reduce some of the dryness and the capillaries which have risen to the surface slightly, okay?
Sounds good, Anna. Thank you.
So, any pain when I press into the tear ducts?
No.
Okay. Let's have a look. I'm going to get you to just look at the light. I'm just going to ask you to follow the light, okay? So, good eye tracking, very smooth. Okay, just blink a few times just to get some moisture back in the eyes. Okay, good. So I'm going to check your peripheral vision. So if you could look straight ahead and just tell me when you can no longer see my finger.
Now. 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 Now.
Okay, any pain, discomfort when gazing ahead, or any kind of discomfort at all?
No pain. No, maybe just my eyes are getting a little bit dry, but that's
Okay.
normal for me.
Okay, alright. We'll give your eyes a rest for the moment, okay?
Sounds good.
Alright, so while we're giving your eyes a rest, we're going to look at the olfactory nerve. And this nerve is responsible for smell, okay? So I'm going to have a little look inside your nose, if that's alright.
Yeah.
Okay. Okay, so just head back slightly. Okay, there's no visible obstructions. Okay, I'm going to ask you to close your eyes. I'm going to spray a scent, and I would like you to just tell me what you can smell.
It smells like lavender.
Okay, perfect. Okay.
Orange.
Perfect, well done. Any pain?
No.
Any issues with your breathing, the nasal passages?
My nose gets runny sometimes. So that's about it. Other than that, nothing.
Okay, I'd probably put that down to the allergies that you mentioned. Okay. I'm going to take a nasal swab, if that's alright with you. We're going to send this off for testing, and it will just look at the bacteria that you've got in your nose, if there's any issues there, okay?
Sounds good.
So I'm just going to put this in just here. Okay, and okay. So those results should be back in a couple of days, alright? Alright, so we're going to focus on the facial nerve and the trigeminal nerve. So the trigeminal nerve sits here, and the facial nerve has branches that spread across the face, okay? And it's responsible for movement and sensation across the face. So what I'll also do is look at the sensation of the head, okay? Because the facial nerves don't just stop here, okay? They run all the way back. Okay. So we're going to do a facial sensation test to begin with. Okay. So I'm just going to use this to do some tapping. So I'm looking for any tingling, numbness, pain, twitching, anything that feels abnormal?
No, nothing so far.
Okay, just trying to trigger anything here. Okay. So, you mentioned that there was tingling on this side. So, I'm just going to follow the facial nerve across the face and just tell me if you feel anything at all, okay, apart from the sensation. How does that feel?
Felt quite pleasant, nothing unpleasant.
I'm just going to ask you to compare both sides now. Anything there at all?
Same sensations on both sides.
Okay, if you could just tell me if the sensation is sharp or soft.
Sharp. Soft. Sharp. 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 Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft and then sharp. Sharp then soft. Sharp and soft.
Perfect. Any pain here?
No.
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 Any shooting pains, sharp electric shock like pains?
No.
What about now?
No, quite pleasant.
Now?
No.
No? Okay. Anything there?
No.
No?
No.
Okay. So I am going to just get you to open your mouth. I'm going to try and touch on the inside of the mouth to see if there's any kind of pain or if we can trigger any spatial sensations at all. Okay, so just open the mouth slightly. Any pain there?
No.
There? There?
No.
There?
No.
And up there?
No. No pain.
Alright. Okay, let's have a look at your hairline and scalp now. No lesions. No inflammation. Slight dandruff. Okay, I'm just looking for anything which might trigger any abnormal sensations or perhaps be causing shooting pains or the tingling that you're experiencing. So I'm just going to get you to look all the way. You're not feeling any electric shocks, are you, from this?
No.
Okay.
Oh, good. It's quite pleasant.
There is some static, so I just want to double check that that's not hurting you.
It's all good.
And I'm not triggering any pain, any tingling, any shooting pains.
No. It does feel tingly, but in a good way.
Okay. Causing some dandruff to come loose. Any pain?
No.
And just bend your head forwards. Any pain there?
No.
Head back. About now?
No pain.
Okay, can you feel this?
Yes. 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 Yes.
Okay, perfect. Just still focusing on the facial nerve. Close your eyes, please. Okay, good. Good auditory reflex on the eyes, okay? If I could just have a look inside the mouth, just looking at good level of salivation. Close your eyes. Close your mouth, sorry. And now close your eyes. Try and open them. Okay. Close your eyes. Okay, so now I'm going to move on to your vestibular cochlear nerve. This is responsible for balance and hearing. So initially I'm going to have a little look inside the ear. Okay. Just lovely and clear, no wax build up. Do you clean your ears regularly?
Yes.
Okay, perfect. Good level of hair distribution. It's not inflamed or red, okay? Same for this side, very clean, good distribution of hair. It's not inflamed. Okay. Alright, can I just get you to tip your head from side to side? Any sensation of fluid in the ears?
No.
Okay. Can you hear this?
Yes.
And that?
Yes.
Okay. Just say left or right on which side you can hear the sound.
Right. Left. Left again. Right. Left.
Okay. You can hear this
Yes.
and this.
Yes.
Alright, just tell me if the sound is getting louder or quieter.
Quieter. Louder. 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 Quieter. Quieter again.
Can you hear the difference?
Yes, all around. Mm-hmm.
Right, I'm just going to ask you to say left or right and to which side you can hear it more.
Left side more. Right. Left. Right. Left. Bottom. Left.
Perfect. Okay, so now I'm going to look at your glossopharyngeal nerve, okay, which is responsible for sensation in the throat. It can sometimes come from the trigeminal nerve, some sensation in the mouth, but we have nerves at the back of our throat as well, okay? So if I can get you to swallow. Any pain there?
No.
And please swallow again. Any pain?
No.
Okay. Okay, if you could just open your mouth for me. Okay. No lesions. No build-ups. Looks lovely and healthy. Okay, just relax. Okay, now the vagus nerve is one of the larger nerves of the body. Okay, it runs down. Okay, it's responsible for the cardiac organs, so your heart, and it's also responsible for some of the movements and sensations in the head. Okay. So what I'm going to do is I'm going to ask you to repeat some words. I'd just like you to say them as you hear them. Okay?
Yes.
Apple.
Apple.
Pineapple.
Pineapple.
Banana.
Banana.
ASMR.
ASMR.
Okay. Just keeping your head straight. Dog.
Dog.
Cat.
Cat.
Sun.
Sun.
Winter.
Winter.
Okay. If I can get you to just cough. And again. And again. Alright. Can you attempt to swallow with your mouth open? Okay. You find that quite challenging?
A little bit, yeah.
Okay. Okay. I'm going to have a little listen to your heart, your breathing now. Take your blood pressure. Okay.
Sounds good.
So let's do the blood pressure first. Okay, I'm just going to get you to relax. Okay, just want you to feel nice and relaxed. Just concentrate on your breathing. Nice and relaxed. Don't slow down the breathing, don't speed it up. Nice and relaxed. Okay, slightly elevated blood pressure. So we're going to do that one more time. Okay. And again, nice and relaxed. Just rest. Okay, there we go. Much better. Well done. Got very normal blood pressure, healthy heart. Okay.
Thank you.
I'm going to listen to your heart now with the stethoscope. Can I just put this here?
Mm-hmm. Okay, that's great.
nice and healthy heartbeat. Just going to have a little listen to how many breaths per minute you do. So just relax your arm. I'm going to ask you to just breathe normally. Please don't speed up the breathing or slow them down. I'm just going to have a listen. Okay, nice and slow breathing, right? Okay, now I'm going to just have a focus now on the accessory nerve. Okay, so please shrug and relax, and again. Okay, relax. Please turn your head to the left and then the other way, and look up to the ceiling and down and back to the centre. Please turn your head this way. Try and turn it back. Alright, and look the other way. And try and turn it back. Okay, perfect. I can get you to just hold your hands out like that. Like that. And I'm going to now try and close your fingers. Okay. Alright, that's great. You just push against me. Perfect. And one hand. And the other side. Perfect. Okay, can I get you to just stick your tongue out for me? Alright, and push it back in. And now open your mouth. Please move your tongue side to side and then up and down. Okay, relax your mouth. Alright, I don't think I have missed anything. Okay. So all of the cranial nerves are very healthy, okay? There's no issues, there's no damage, there's nothing that worries me at all. We did go through all of them. We did a very detailed facial nerve test, and I didn't manage to stimulate any tingling or numbness. What I would suggest is that you reduce your caffeine intake, okay? Tingling is a very normal sensation. It can just happen to people, alright? What I would suggest is reducing the amount of coffee you're drinking each day. How many glasses did you say you were having?
About 5 every day.
Okay, so I would probably say for a woman 2 max, alright? It's a lot of caffeine. Okay, there is an argument that caffeine can be beneficial to the vascular system, but 5 or 6 cups you're going to be struggling, maybe putting a little bit of pressure on the heart. Okay.
Yeah, too much. Definitely, I'll cut that down.
Yeah, that would be great. I'm going to suggest you come back in 6 months and we redo the tests, okay?
Yes.
We can see if there's any difference there.
Sounds good, I'll be here.
Okay, perfect. Well, hopefully I don't see you before then and you stay nice and healthy. But otherwise, I look forward to seeing you again soon.
Thank you so much, Dr. August.
Okay, thank you.